request to start this media briefing. My name is Phaahla. I'm responsible for media relations in the National Department of Health. So just to outline the lineup of today, as usual, we are going to start with the Honorable Minister, Dr. Phaahla, who's going to give us the opening remarks and the message of the day, which will be followed by our epidemiologist, the scientist from the NICD, who will give us the update as far as epidemiological report is concerned. That will be followed by the preparations for the fourth wave, which we're going to get from the Gauteng province. As you know, that is one of the hardest hit, followed by a national overview by both Dr. Mr. Mrewani and Dr. Maluleke. Then we'll take questions and answers session followed by the closing remarks by the Honorable Deputy Minister. So without wasting any time, I'm going to hand over to the Honorable Minister, Dr. Phaahla, to give us the message of the day. Over to you, Minister.
Thank you very much. Thanks, Foster. I hope, I don't know what my computer is doing with me, but I hope it's still visible. Thank you very much for this opportunity, and good morning. I hope the Deputy Minister has been able to join. Also greetings to our guests for this morning, Dr. Wasila Jassat and Dr. Michelle Groom from the NICD. We are pleased also to be joined by Dr. Maluleke from the Gauteng Department of Health, and also from the National Department of Health, a team which is led by Dr. Buthelezi, Dr. Nicholas Crisp, and I think Mr. Mrewani and Mr. Naidu and others are also on the platform. And good morning to all South Africans. 8 days ago, we announced, together with our medical scientists, who were led by Professor Tulio de Oliveira, that they had identified a COVID-19 variant which could be associated with a sudden rise in new infections. About 7 to 10 days before that, we had started to recognize a steady rise in new infections from the low levels of around 200 to 300 cases per day, which we are doing, to a steady rise starting at around 500 to 600 a day, rising steadily to 700 to 800, and then suddenly also surpassed the 1,000 cases per day. Analysis of the geographic distribution had shown that these were limited still to Gauteng, and mainly starting in the Tshwane Metro, and even some districts could be identified, some of it closer to the TUT campus in the Tshwane Metro. The confirmation of the new variant in this Tshwane area explained the steep rise in new infections. And it was showing that this could then be attributed to this new variant which our scientists had identified. The steep rise was also going beyond the Tshwane area, spreading into the rest of Gauteng, into Johannesburg, into Ekurhuleni, and also a little bit into the Sedibeng and Western areas by the time this finding was announced by our medical scientists. It is now history that the World Health Organization, after the report by our scientists, confirmed that it is indeed a variant of concern and named it Omicron. Because I'm emphasizing the variant of concern because we have been long alerted to the fact that this virus would be mutating at a regular basis, and that there will be now and then some variants, but some of them may only just be variants of interest and not really of concern, in that they would not cause a lot of change in the epidemiology. We again want to take this opportunity to thank our team of scientists who really worked very hard in identifying this variant, which was subsequently named Omicron. We want to thank the genomic network, the genomic surveillance network, for their hard work and diligence It is indeed a matter of regret and a reflection of hypocrisy by some of the countries that while their leaders, without exception, are singing praises of the expertise and also the openness of South Africa, but they still went ahead to slap us with travel bans, which included also many of our neighbors in the SADC region. Over the last 7 days, we have expressed our own outrage and disappointment at this misguided and counterproductive action by some of the countries. But we want to thank the vast majority of nations which have not followed this destructive path, which undermines international cooperation and solidarity in the common fight against the COVID-19 pandemic, and others are still coming on. And we also want to thank all those who have stood with us and supported us while we had to go through this very difficult situation, which has got a serious impact on our economy. As we were entering the second wave of COVID-19 around this time last year, in 2020, our scientists, even at the time, led by Professor Salim Abdul Karim, told us that we should expect mutations of the virus, leading to various variants of this virus, and some of whom would be serious. At the time, we were being introduced to the Beta variant, which hit us around this time last year. They warned us that the variants would generally be more transmissible, but most of the time they would be less severe. Today, as we enter the fourth wave with a new variant, we can see confirmation of this warning. We have moved from a total of around 2,465 new cases last Thursday when this variant was announced, to yesterday's highs of 11,535 yesterday afternoon, a rise of just over 9,000 new cases per day within 7 days. What we can say is that we actually were alerted, as I've indicated before this fourth wave, that it was coming, but we didn't know how soon and what special characteristics the new wave would take in terms of whether there would be variants and what would be the characteristic of those variants. As can be seen from the steep rise in numbers over the last 7 days, and as we'll see from the presentation by our NICD team, the curve which depicts this rise in infections is very steep, which is much steeper than any other rise and curve which we have seen in the previous 3 waves. What we must re-emphasize is that while our scientists and those also colleagues, medical scientists in Botswana, who we must also congratulate for this hard work, while these were the scientists who first discovered and reported this variant, no one really knows where this variant originated from. We know that gatherings and social activities like parties and other big gatherings, close gatherings, are super spreaders, and that as we have indicated in the introduction, that when we started seeing the rise, they could be identified to particular areas in Gauteng and in the Tshwane Metro. Some of it was, as we said, closer to the Tshwane University of Technology. Over the last 7 days, the new spike has moved into the whole of Gauteng, and it's also registering presence in all our 9 provinces, with numbers starting to rise in the Western Cape, in KZN, in Limpopo, in the Northwest, and in Mpumalanga, also with high positivity rates. Currently, only the Free State and the Northern Cape are still showing relatively low numbers and low positivity rates, even though even with them, we're not talking about the 1 to 2%, but between 3 and 5% positivity rate. So every area in the country is starting to register high levels of infections. As will be confirmed by our NICD team, while we are still dealing with few days and limited data, indications are that this variant is indeed highly transmissible, including infections of people who have been vaccinated, but are causing mostly, but the infections are causing mostly mild illness, especially for those who are vaccinated, with hospital admissions mainly dominated by those who are not vaccinated and young people below the age of 40, most of whom are not vaccinated. At this stage, we can say that even in Gauteng, which accounts for 72 to 80% of the new daily infections, we have not yet reached threatening stages in terms of our hospital capacity and the new hospital admissions. The total current active cases stand at just over 47,000, with hospital admissions just below 3,000, with significant spare capacity in both our public health facilities and also in the private hospitals. New cases increased by more than 300% in the last 7 days, and positivity rate is now, as of yesterday, at 22%, up from the lows of 1 to 2% about 2 weeks ago. At this stage, the trend is indeed that of a rapid rise in cases, but we hope that the mild nature of the illnesses amongst those who are infected will continue to be the dominant feature. Our Gauteng team and the national team will confirm that we are doing everything possible to make sure that we can handle the provision of health services for those who will become seriously ill. One change that is threatening to destabilize is that even though most of our vaccinated health workers who get infected have mild symptoms, they still have to isolate, leading to possibilities of shortages, as we can see in some of our hospitals while they are in isolation. So we will have, together with our colleagues in the provinces, starting here in Gauteng, we will have to address this phenomenon that because even though the health workers who are infected have mild symptoms, they still have to go into isolation. We want to appeal to all South Africans that the time is now for more vigilance to apply all our tried and tested health and safety measures, which we know very well, which our president also has emphasized on Sunday. That is the wearing of masks, hand washing, sanitizing, physical distance, avoiding crowds, and also being in areas which are well ventilated. Above all these measures, the main opportunity now, which is different from when we had the other waves, especially the first and second wave, is that we have opportunity to be vaccinated, which provides a major protection against serious illness. Above all this, therefore, let us take the opportunity to be vaccinated. We applaud all South Africans who have come forward to be vaccinated. As of last night, just over 16.7 million of us had been vaccinated, with over 26.1 million doses administered. As we speak now, 42.1% of all adults have received at least one vaccination dose, with 14.6 million, which constitute 36.8% of the adult population now fully vaccinated. As of yesterday, the Free State province became the first one to reach 50% of all adults in the province with at least one jab, and it should cross that 50% mark later today, while Limpopo province and the Eastern Cape are just on their heels at just over 48%, both of them, and we expect that in the next few days, they also will cross the 50% mark. So we call on all those who have not completed the full vaccination with the Pfizer vaccine. There are many who have taken only one dose, even though they've long been due for the second dose, we really appeal to them to come forward and complete their vaccination so that they can be fully protected. Because what we have also seen is that while having at least one dose does provide some protection, but it's just not enough because it doesn't provide the full protection which is required. As we know by now, all adults and all children over the of 12 years and above are eligible for vaccination. This fourth wave, which we have started to enter into, can be managed without too many casualties, without too much loss of life, if we all observe the safety measures, the biggest risk being gatherings, especially indoor gatherings. We're blessed with a warm weather at this time of the year. So if we need to have gatherings, let's make sure that this happen outside where we are well endowed with fresh air. But if we need to protect from the hot sun, we can have the cover, but make sure that it's in a situation where there is a full fresh air. Just protect ourselves from the hot sun. And we also advise that even when you have evening gatherings, please, as far as possible, have them outside. But above all, we want to repeat again that we can save lives, save our loved ones and friends and work colleagues by making sure that we are vaccinated. While there are still some questions around the Omicron variant, while more research is going on, not only here in South Africa, but all over the world, the evidence that is very clear thus far is that, like all previous variants, our best protection against serious illness lies with the vaccination. We must therefore not hesitate to take the vaccine because of this Omicron variant. The vaccination provides our best protection against serious illness and death. We must remember that no one amongst our scientists had ever said to us that the vaccines will prevent us from being infected with the virus. They've never said to us that while we are vaccinated, our bodies the virus will never enter our bodies. But that what they've always said, and which we're seeing as these waves are getting into operation, that 80 to 90% when you are vaccinated, you will get mild illness. And as I've indicated, this is what, even with this variant, that's what we are observing. So vaccination is not just an option, but a major matter of saving lives, saving also livelihoods, because when we are, most of us vaccinated, we can have more economic activity. And we want to, and by vaccinating, we will also save many more of our gallant health workers from being overwhelmed with a lot of infections with this Omicron virus variant. We wish our health workers all the strength, all the fortitude and protection in the tough days laying ahead of us. And again, let us do everything to protect them by vaccinated. This weekend and the coming week have again been declared by our president and the deputy president as a Vuma weekend and week. And we again call on all South Africans to take the opportunity as vaccination sites, more of them will be opened over the weekend and as we go into the rest of the week. Thank you very much, Mr. Mohale.
Okay, thanks, Minister, for that keynote message and update as far as we are as the country. Indeed, as things stand now, vaccine is the only or is the most effective weapon to fight this variant. So without wasting any time, I'm going to hand over to our epidemiologist, Dr. Michelle Groom and Dr. Wasila Yassad, to give us the update as far as this variant is concerned. Over to you, Doc.
Great, thank you very much. Good morning to everyone, esteemed or distinguished Minister, Honourable Minister, Deputy Minister, colleagues and those from the media and viewers. So I think we're just going to give an update. The Honourable Minister has highlighted some points, and so just to give some of the details of this. So at the moment, we are seeing a total number of just under 3 million laboratory confirmed cases, and we have seen this rapidly increasing 7-day moving average. So I think most of you have been hearing about this, and this is just a way that we average out cases over the last 7 days in order to give a smoother curve. As we know, from day to day, there might be some variation with lower cases often detected over the weekend periods. And so just 2 weeks ago, we were seeing a 7-day moving average of just over 300. In a week, this climbed to just over 1,000. And yesterday, our 7-day moving average was 4,814. And I think because it's not, and we've seen this rapid increase in the last 2 days, which is really going to push this up quite rapidly. And as the Honourable Minister said, we have now, yesterday, recorded 11,535 new cases. And I think if you just have a look at the slope of this increase compared to the previous waves, you can see that we really are seeing an unprecedented increase in the number of new cases in a very short period of time, you know, really just climbing right up in terms of these numbers. So just looking at this by province, so we have seen that this has been concentrated mostly in the Gauteng province, where it started off with these clusters in Tshwane and quickly spread to other districts, and we are now seeing increases in all of these districts. This is the incidence. So the incidence takes into account the underlying population. We know that Gauteng is the most populous province and is likely to have the most cases, but if you account for that, you see that we are still seeing this very rapid increase particularly in Gauteng. So if we look at our testing, so as you know, we are doing both PCR tests and the rapid antigen tests. And so the percent positivity is a very good measure of what is happening in terms of the case numbers and the pandemic overall. And so we've been tracking this, and you can see that during waves, the percent positivity is high. Between waves, this is low. And we were at the lowest point we've ever been since the start of the pandemic. Between the second and third waves, we'd reached about 4%. And after the third wave, we had really gone down to a 1% positivity rate. And as you can see, there's been this rather rapid increase in the last couple of weeks, from 2% to 8% last week. And this week, we've seen over the last 3 days increasing from 10 to 16, and yesterday was over 22% nationally. This is just shown by province. So once again, this is the percent testing positive over the last 3 weeks. And so you can see that there's been this tremendous increase in Gauteng, going from kind of 4% all the way up to and this was at the end of last week, 16%. But we are seeing increases in the other provinces as well, particularly Northwest, Gauteng, Mpumalanga and Limpopo, but starting to see increases in the other provinces as well. And so you can really see that this is, you know, data up until last Saturday. And this is really data from yesterday, where you can see this positivity rate in Gauteng has now climbed up to 34%, 28% in Limpopo, and also over 20% in Mpumalanga and Northwest, and starting to see these increases in the other provinces as well. Looking at age group, so once again, this is the proportion that are testing positive. You can see that this really is concentrated. The grey is the 20 to 29-year age group, the orange, the 10 to 19, and the yellow, 30 to 39. And so you can really see these are the age groups in the last weeks that have started increasing first and are rapidly increasing. But as you will note, this has spread into the other age groups. And so while many of these did start as clusters in our younger people, we are seeing spread into the older age groups as this wave progresses. These are our wave metrics, and we were in the process of redefining these wave metrics. The current metrics we thought would be less useful going forward, but unfortunately we didn't expect the increases quite so soon, and so we will still be using the old wave definitions. And you can see that as nationally we are seeing a sustained increase, which is the orange. We're seeing a sustained increase in all of the provinces except Northern Cape. Free State has just started. And you can see Gauteng, I think, with the updates of the metrics today, is going to officially be in the fourth wave according to this metric. The reproductive number is also a metric that we have been tracking, and the NICD regularly puts out a report on the reproductive number, which is really just the number of other people that an infected person can infect, and this has increased. So if it's under 1, this is what we're seeing kind of in the interwave periods, and you can see this rapid increase in the reproductive number. And so over 1 in all of the provinces, which means that each person is going to affect more than 1 other person, and very, very high in Gauteng, over 2. And this is the highest that we've ever seen it since the start of the pandemic.
Good morning, Honourable Minister and guests. I'll just share some information from the hospital surveillance. This is the 7-day moving average of hospital COVID-19 admissions on the left from April this year. And you can see after the 3rd wave peak, the admissions came down to quite low numbers. And nationally, you can see the 7-day moving average increasing over the last few weeks. On the right, you can see that hospital admissions have been increasing nationally in both the public and private sector. So on the left, you can see the increase in hospital admissions by province, with the bigger provinces on the left and the smaller provinces on the right. And you can see that national increase is driven largely by increases in Gauteng in hospital admissions, but we're also starting to see increases in the smaller provinces. So this table will show you more clearly when we compare the daily average admissions in the current 14 days with the previous 14 days period. We can see clearly Gauteng has had a huge increase in average admissions from 19 to 78 admissions, but other provinces also starting to increase, small increases for now, but we're noting increases in admissions over that 4-week period in Eastern Cape, Limpopo, Mpumalanga, and Northwest. Also, we are starting to observe small increases in the comparison of daily average deaths in Eastern Cape, Gauteng, and Northwest.
So just looking then at the specific provinces and with a focus on Gauteng, as this is where we're seeing the highest numbers. So once again, you can see this very rapid increase with at the beginning of November, a 7-day moving average of 80. And this has climbed to over 3,500 as of yesterday. And you can see, I mean, this almost, you know, this very, very sharp increase compared to the other waves. These are just plots of the percent positivity. And so this was the week before last, where you can see those initial increases in towards the Tshwane district, which has now really increased in that district, filtered into the rest of Gauteng. In terms of just showing the districts that this has been observed in all of the districts, obviously Tshwane had taken the lead, but we're seeing increases in all of the districts. And the age proportions quite similar to what we were seeing nationally, with mostly in the 10 to 19 and 20 to 29-year-old. You can see that's where we start seeing those increases. That was the age group that was affected. And there has been this rapid increase, but we're now seeing increased positivity rates in all of the age groups. So shifting into the higher age groups.
Just to share COVID-19 admission trends in Gauteng in a little bit more detail. On the left, you can see the increase in Gauteng is equally in the public and the private hospital sector. And on the right, you can see the earlier increase in the Tshwane district, and then in week 45, and then in the most recent week, you can see increases across all the other districts as well. I think it's important to also compare the trends in the increase in cases against the trend in the increase in hospital admissions. So on the left, you can see the 7-day moving average of cases in blue across the entire pandemic, and admissions in red. And you can see that over the last few weeks, there's been a rapid increase in admissions and deaths in terms of the 7-day moving average. And to look at that and understand that rate of increase in more detail, on the right, you can see the week-on-week change in cases in blue and admissions in red. And you can see that very steep increase in both cases and admissions, and you can compare them to the previous waves, and it's clear in Gauteng the week-on-week increase we're seeing in cases and admissions is higher than we've seen it before. Also wanted to share some data on the trends by age group in Gauteng. On the left is the incidence risk of admissions for those under 20, so children, and you can see them in different age bands. And, we've always seen children not being very heavily affected by the COVID epidemic in the past, not having many admissions. In the third wave, we saw more admissions in young children under 5 and in teenagers 15 to 19. And now at the start of this fourth wave, we're seeing quite a sharp increase across all age groups, but particularly in the under 5s. But to show what that means in context, on the right is the admission incidence risk by age group, and this includes all age groups. So apologies, it looks very busy, but I'll take you through it. Right at the bottom, you can see the young people 5 to 19. In yellow is 15 to 19, in grey 10 to 14, and in red 5 to 9. So as expected, the incidence is still lowest in those in children. However, the incidence in those under 5 is now second highest, and second only to the incidence in those over 60. And so the trend that we're seeing now that's different to what we saw before is a particular increase in hospital admissions in children under 5 years. Just to shine a spotlight a little bit more, in the city of Tshwane Metro, we tried to compare the first 2 weeks of the third wave and the first 2 weeks of this fourth wave in terms of the number of admissions by age group. And so what you can see in blue, in the third wave, most admissions were in older people, 50s and 60s. However, in red, in the fourth wave, you can see most admissions are in younger people, less than 40 years, and particularly stark differences in the 0 to 4 age group, where there were very few admissions in the third wave in the early part of the wave, and over 100 admissions in children under 4 already in Tshwane in the first 2 weeks of the fourth wave.
So just then quickly to run through some of the other provinces as we are starting to see increases there. I won't go into as much details with Gauteng, but we are seeing in Northwest also very similar, this very rapid increase with increasing positivity rates and starting to see some indication that hospitalizations are increasing in both the public and private sector and in all of the districts. Similarly in Limpopo, also seeing the sharp rise, positivity rates up, and you can see that this started very much in those districts bordering on Tshwane, and so we are seeing increases in both case numbers and percent positivity, and still very low numbers of admissions, but starting to see some increases in some of the districts. Mpumalanga, very similar with these rapid increases in case numbers, positivity rates also up, once again, initially in those districts that are bordering on Gauteng, and also starting overall low numbers of hospitalization, still lower than what we were seeing, obviously, even at that interwave period, but starting to see some small indications of increases there. Western Cape, at this point, we are starting to see increases there, as well as in KZN, as yet not seen any indications of increases in hospitalizations, but we know there is this lag between case reporting and reporting of hospitalizations. Eastern Cape also, just at the start of increasing cases, as well as starting to see some increases in Free State. As yet, Northern Cape has not really been seeing any increases. So I think just to sum up, we've seen this rapidly increasing number of new cases, percent positivity and testing rates. This started in the younger age groups, but we do see it moving into the older age groups. It's been a really rapid increase in Gauteng, initially starting in those clusters in Tshwane, but quickly spreading to all districts, and we're seeing increases in all districts. Increased case numbers and positivity especially in those provinces that are bordering onto Gauteng, so seeing increases in Limpopo, Northwest, and Mpumalanga. Starting to see some increases in the other provinces as well. And we've seen this rapid increase even in hospitalizations in Gauteng, starting to see small increases in Northwest, East, Mpumalanga, Limpopo, and Eastern Cape. And there is this trend of increased admissions in children, especially under 4 years. Look, it is very early on in the wave. At this stage, disease did start in the younger age groups, and so we will know more in terms of monitoring this age group in the coming weeks. But I think we do just need to highlight the importance of surge preparedness to also include pediatric beds and staff. We need additional data, as the Honourable Minister highlighted, both in terms of disease severity. So at this stage, I know there's been lots of, in the media on this being, very mild, but really just to note that we see the disease, the severe disease endpoints a little bit later. People tend to be hospitalized kind of a week to 2 to 3 weeks after their initial diagnosis. And so while we're seeing kind of the mild spectrum now, I think we really can't say anything in terms of disease severity without waiting for additional data in the next 2 weeks. We're also seeing those initial increases in the younger people, which are also more likely to get mild disease. In terms of transmissibility, there's definitely early evidence that this virus or this variant is more transmissible, and also early evidence that there is some degree of immune escape. And as the Honourable Minister mentioned, in terms of the possibility of people who have already been being reinfected, and as well, vaccination will prevent against the severe disease, but you may still get infections even though you've been vaccinated. And so really just to reiterate that regardless of the variant that we're seeing, we still have the same public health methods available as the Honourable Minister spelt out in terms of increasing our vaccination rates, continue to wear our masks, social distance, and particularly over this period, I think to limit large gatherings. We know the virus is spread from person to person, and this is the way that it will be spread if there are these large gatherings. And just to encourage everyone to really vaccinate. Vaccination is going to prevent the severe disease. So that's it from me. Thank you very much for the opportunity to present.
Thank you, the two doctors, Dr. Michelle Groom and Dr. Wasila Jasad, on the epidemiological report. So without wasting any time, we're going to call upon Dr. Ntsakisi Maluleke and followed by Mr. Morewani, who are going to give us the state of readiness. This is saying that when Gauteng is coughing, the entire country catches the flu. So Dr. Maluleke is going to tell us the state of readiness to deal with the cough as far as the fourth wave is concerned. Without wasting any time, I'm going to hand over to Dr. Maluleke to take the podium. Over to Dr. Maluleke.
Honourable Minister, Deputy Minister, DG, members of the press, colleagues, ladies and gentlemen, good morning. It is indeed an open secret that Gauteng has currently been experiencing an increase in the number of observed new COVID cases in the past 2 weeks, and that our test positivity rate has also increased, as well as in-hospital patients and deaths. The phenomenon of young children, younger age groups, as well as pregnant women having increased infection is currently being investigated. We are hoping that in the coming weeks, we'll be able to also give reasons for why this particular cohort of patient is having increased infections. Looking at current hospitalizations, my colleagues from the NICD have gone through the increase that is above 50% in the last 2 weeks, particularly for Gauteng in terms of in-hospital patients. We are currently sitting at 1,351 in-hospital patients across both public and private sector, with majority of these patients being in general ward beds, being 1,121 patients. Of the patients who are in hospitals in the public sector, 118 COVID positive patients are being housed in our alternative building technology facilities, commonly known as ABTs, and 57 patients are patients who are under investigation. Our ABTs are also being used as quarantine and isolation sites, particularly AngloGold Ashanti for the West Rand, Bronkhorstspruit and Jubilee in Tshwane, which has had over 60% of our in-hospital patients in the last 2 weeks. And then in the Johannesburg region, we are using Lenasia, Discoveries, and Eskom as quarantine and isolation sites. And that particular district currently has 19% of those 697 patients who are in hospital. Looking at the private sector, of the 654 patients, which gives them a bed occupancy rate of 16%, 188 patients are housed within the various hospitals across the Netcare group, and 134 are housed within the various hospitals in the Life Hospital group. A variable that we have been tracking in recent times is the vaccination status of our in-hospital patients. Data is still being collected, but of the those that have reported status, 23% in-hospital current patients are said to be unvaccinated, and 2% are vaccinated. In order to ensure that we are adequately prepared for this coming wave, we have not deviated from previous strategies that have been used in the first, second, and third wave in terms of bed occupancy. So from the 18,000 odd beds that are available across the public sector, we have decanted some of these wards, repurposed, as well as built alternative building technology facilities in order to now have 4,407 functional dedicated COVID beds across the public sector. Of those 4,407 dedicated COVID beds, 3,644 in the public sector are general ward beds, 615 being high care beds, and 148 of those beds being ICU beds. Our modelers have given us a recommendation that we need to ensure that we have 4,000 beds that are available across public and private at the peak of this current wave. In preparation for the peak of the wave, Gauteng has also doubled the number of beds across public and private to also then accommodate patients who are under investigation, because majority of the patients who come into our hospitals that are under investigation are very ill and needing hospitalization, more than needing quarantine and isolation. So that is the reason why we then, in preparation, double our bed capacity. Our private sector counterparts have not reported a decrease in the number of beds also that they have availed for this current wave, with 1,749 of those beds being dedicated ICU and high care beds. A very important arm of ensuring that beds are functional is having human resources for manning of the beds. So when we look at this current wave, we have received additional funding for to now have personnel for 8,179 patients that are in COVID posts. 77% of these posts have been filled. The additional 2,638 posts, funding was given to us from May to now, from the last wave to this current wave. This is just a graphical representation of the posts that have been filled and those that are still lying vacant. Oxygen and PPE response is very crucial. Currently, due to the lower numbers that we have across the hospitals, we are meeting on a weekly basis with all our facilities, as well as AFROX, to ensure that we do have enough oxygen security and that PPE is adequate. As the pressures and the demand rises, these engagements increase to daily. I cannot overemphasize the need and the importance of vaccination, as also mentioned by the Honorable Minister. We commend the 7 million vaccines that have been administered within our province. However, this only places us at just under 40% of individuals who have vaccinated within this province as a proportion of the population. So we urge the remaining population to please vaccinate in order to reduce disease severity and also in order to reduce the need for hospitalizations. Of those 7 million vaccines that have been administered, 3,751,000 patients have been fully vaccinated. And in conclusion, we are saying that, yes, we see the sharp increase in COVID-19 infections. We are aware of the various work that is being done across the medical fields to look at disease severity, transmissibility, as mentioned by my colleagues in the NICD. We are closely monitoring these infections, but we do also urge the public to please go to the various vaccination sites that are available across our province and vaccinate. And while you vaccinate, please also ensure that you do not forget to wash your hands, wear your mask, social distance, and stay away from those big gatherings. Thank you.
Thank you, Dr. Maluleke, for that brief presentation as far as the state of readiness the province is having. So without wasting any time, I'm going to call upon Mr. Mrewana to give us the national picture. Over to Mr. Mrewana.
Thank you very much, Foster. Good morning to the Minister. Good morning to media and everybody on the call. I'm going to be making a presentation on the state of readiness. Just getting my system in order here, so that I can show my screen. Can you see my screen first?
Yes, we can see it, but it's not on a presentation mode. F5 can assist to take it to presentation mode.
Okay, I'm going to say Is it visible now?
Still, it's visible, but there's not. Yeah, now it's visible. You can go on.
Okay, thank you very much. I'll go ahead very quickly. Good morning.
Okay, thank you very much.
As I've already greeted, the presentation that I'm going to make is on the state of readiness for the fourth wave. What we did when we became aware that the fourth wave is inevitable, we engaged in a thorough process of planning, and our planning was based on the experience we had with the third wave. What we asked provinces to do was to then do a review, what is called the intra-action review, where they review and learn lessons from the third wave and make use of those lessons to plan for the fourth wave. So we did that. We then followed through with the planning workshop where all provinces were present to develop the resurgence plan for the fourth wave. So indeed, we have really been keeping our eyes on the ball in this area. I want to take you through quickly the key pillars that we used when we were planning for the fourth wave. In the areas of governance and planning, as I said, we had the 2-day workshop. Now, what did we do? We then asked provinces to develop their plans. Once they developed their plans, they finalized them, they submitted them. We then produced a national plan for the fourth wave. In terms of coordination of this work, we have a workstream that's called Health Facility Readiness Workstream. It concluded its own resurgence plan apart from the departmental one, which then drills deeper into specific areas of hospital readiness. And the department has actually allocated very senior people who work with the provinces. And what we did, we targeted those provinces that struggled with the second and third wave, but also provinces that are in the eye of the storm. There's an oxygen task team that meets every day, every week, and they've also been able to produce a plan. And the service provider, which is AFROX, has finalized the plan for the fourth wave, and that plan is available, which gives us guarantee of a sustainable supply of oxygen during the fourth wave. We have activated resurgence plans in all facilities. what we have done is we have ensured that the facilities are ready, and by that we mean, one, our beds must be available, and all hospital beds that were available and were required during the third wave, they must be prepared, be made available for the fourth wave. And we are also having adequate equipment. In fact, we have in our hospitals strategic reserve in the event that we run short of this equipment or they break down. There's also, again, at NDOH, another stock that's available for deployment whenever it is necessary. So in that regard, all the devices are ready. This slide just shows that currently we haven't seen a much pressure. Our bed occupancy in terms of general bed is still at 1.9%. And in terms of ICU, our bed occupancy is standing at 4.2%. But this is a situation that we are monitoring quite closely. Now, in terms of general readiness, as colleagues have already indicated, that we're seeing an increase in the number of admissions among the under 5 years old. We are also paying special attention to the pediatrics ward to make sure that that area is also adequately covered. And we have made sure that there's adequate clinical guidelines that have been shared with provinces so that clinicians can get better support and guidance as and when that is becoming necessary. And I've already spoken about oxygen readiness. I just want to indicate that it is our view that the successful oxygen management depends on the proper governance between service provider and hospitals. And what provinces have been asked to do is to make sure that oxygen is made available to all the beds that have been earmarked for oxygen for COVID-19 care. And I've already spoken about the contingency plan. And all we need to do is to have proper monitoring for the implementation of the contingency plan so that we leave nothing to chance. What we have done regarding oxygen, because oxygen has been found to be a major intervention mechanisms for COVID-19 management, particularly in the clinical space, we have then set together a modules, about 5 modules for training of clinicians on the ground. The first one deals with introduction to medical gases. The second one deals with oxygen in hospitals. The third one deals with management of oxygen cylinders. The fourth one deals with oxygen manifold systems. And the last one deals with liquid oxygen. So we just want to make sure that everybody is covered in that area, because in times of crisis, people may just require some bit of refreshing, even if they have knowledge about some of these aspects. What we're also doing, as we're preparing ready for the fourth wave, we're also working on the improving or continuing to deliver essential services. So we have developed guidelines with the support of World Health Organization, and we have actually provided provinces with that guideline, and we're monitoring key service delivery indicators, because we know that during COVID-19, many services may have been affected by people not being able to go to the facilities. So therefore, we're working on the continuity of essential services as part and parcel of our own preparation for the fourth wave. Thank you very much, Foster, and over to you.
You can remove the screen, Mr. Mrawane. Thanks for presentation. Yeah, now without wasting any time, I'm going to take the first batch of questions that we've received so far, which read as follows. The first question is from Mia Lindiki from EWN. She's saying, why is there no public uproar around the people who have just tested positive now, then going into a pharmacy to collect a medicine scripted by a doctor, and also for the loved ones who have tested positive, queuing for medicines while they know that they are supposed to be in isolation? Second question is from AFP. When you compare the current hospitalizations to like cases from first and second week ago, the percentages imply similar levels of proportional hospital admission to Delta wave. This is evident. This evidence implies that the severity of this variant is equivalent to that of Delta. Is that correct? The third question is from Anthony from Bloomberg. He says, I was told yesterday that there's been a higher proportion of young women admitted compared to the last wave. Is this correct? If so, why do you think this is the case? Another question is there an evidence that this variant Omicron is less severe than Delta wave? and given it is exhibiting vaccine escape for transmissibility. The last few questions, are we already in the fourth wave or not? I think this one, the minister and the colleagues can be able to touch on this one. What is Gauteng's positivity rate? The last question before I hand over to Minister and members of the panel is from Rian from Business Tech. In addition to increased vaccination drive, what additional lockdown measures is the government considering to potentially cap the fourth wave, if any? So I'm going to allow the panelist minister to respond to this question before I take the second round of questions. Over to you, Minister and members of the panel.
Well, thank you very much, Foster. I think most of the questions, our team from the department, Dr. Buthelezi, Dr. Crisp, and the NICD team could handle. Just the last one on the lockdown, what measures? Well, at this stage, as we long ago adopted a risk-adjusted approach to managing COVID in terms of the social intervention and restriction measures. So we are again approaching in the same way as a risk-adjusted. So we agreed on Saturday last week, the national coronavirus met, followed by cabinet on Sunday, and the premiers and mayors under the Presidential Coordinating Council. What we have agreed is that in the coming week, there will be a follow-up meeting. We needed just over a week to monitor the situation and see what measures needs to be taken. So at this stage, one would not want to preempt. There will be a meeting in the coming week, and we'll look at, for instance, amongst other things, we have seen already the rapid rise, but we also would look at what pressure.
All right, we have to say goodbye to you. I know it's a very important briefing. We'll continue to bring this to you live. Have a good weekend. That's it from us.
Indeed. Please take care, be safe, and of course, weekend morning.
Raise the level of restrictions from the level 1 where we are. So we'll look at all those measures. But again, I just want to reiterate to say, while we should be saying what is government going to do, I think all of us individually and collectively, we could even reduce the level to which even a sort of regulatory intervention could be required by simply, especially, just the wearing of masks, the normal things, and the key really is just avoiding big gatherings, especially indoor. So as also our Excellency President has said, let's reduce the end of year parties, the birthday parties, especially indoor. If anything is going to happen, let's have it outside and make sure that we are not congested even when we're outside. The rest of the other areas, can I ask the team between Dr. Crisp and Dr. Buthelezi with our team from NICD. I think the question of people who know they are positive and then going out to queue, whether it's for medicines or groceries, that's really very irresponsible, and we should really, all of us, condemn that and advise people that the norm is very clear. When you tested positive, or even when you have been a contact, until your results come, you have to keep away from mixing with other people. If you don't have a place where you can be able to keep away, all governments have facilities in all provinces for you to can stay while waiting for your results. But once you have tested positive, if again you don't have the facilities at home, please approach the nearest health office so that they can link you up with facilities where you can bring your belongings and be able to be catered for in a secure place. Can I ask the team to look at the question? I think the NICT colleagues will be better placed. Severity, is it the same as Delta? Proportion of young women, vaccine escape, Gauteng, the positivity rate, I think is well known. Dr. Maluleke would be able to talk to that. Over to the team, NICD, and where our health department colleagues can come in, and Dr. Maluleke. Maybe we can start with the NICD team. I think some of those, they are better placed to answer.
Thank you for those questions. So I'll take two of the questions. Why are there more females being admitted? We've always seen more female cases and more female admissions throughout all three waves of the pandemic. Whether this is because there's a increased susceptibility amongst females, it might be about them being in frontline services and being exposed more, and it might be health-seeking behavior that they're more likely to test and they're more likely to go to hospital for admission if they're sick. But it's certainly we are seeing more females admitted, but that's nothing new. We've seen that throughout the pandemic. There's always been more females admitted than males. However, the risk of mortality has been higher in males compared to females. And there were quite a few questions about severity. I think, as Dr. Groom said earlier, it's too early to say. Our data, tells us a little bit about patients in ICU, ventilated, on oxygen, but it takes time for the, admissions to unfold and for the severity measures to come about. What we also see is that severity is always low in the early and late part of the wave. And we know from the three waves, mortality was highest as the wave progressed, and particularly at the peaks of the waves, we had the highest mortality. So I think even if we are seeing a slightly less severe disease right now, it's too early to say that that's a characteristic of this variant, because it's also a nature of the phase of the wave. And we definitely do see less severity in the early and late part of the wave. And so part of why that is because, in the hospitals, there's lots of patients being tested when they're admitted for other reasons like elective surgeries, and many of them test positive. There's pregnant women come in for labor, and some of them are asymptomatic but test positive. And so there's admissions in patients who will test positive, but they not necessarily have COVID symptoms. Another reason is that at the early part of the wave, when there's a lot of hospital beds still available, GPs are more likely to admit patients who are milder, who otherwise they wouldn't admit at the peak of the wave when beds are more strained. And certainly we've heard from pediatricians that some of the admissions have been short stays for a day or two, a child with high fever for fever control, a child with diarrhea and vomiting, testing COVID positive, admitted for fluids. And so, yes, I think there's a more chance to admit patients earlier in the wave when they are beds, even if they are a bit milder. So certainly I think that over the next few weeks, we will have more data. Once these patients have, gone through the admissions, they've had outcomes, we'll be able to say better whether the severity is any different in this wave compared to previous waves.
I'm not sure whether any further I think there was something about vaccine escape. I did not get the full question. There was something, Foster, maybe you could repeat. There was something on vaccine escape, which I thought possibly our NICD colleagues could also talk to. And then Dr. Maluleke can come in. Foster? The question on vaccine escape, can you still find it?
Yes, I can. Yeah, I got it. The question reads as follows, the Minister and the panelists. Is there any evidence that Omicron variant is less severe than Delta wave? And given it is exhibiting vaccine escape for transmittability, I'm not sure if it makes sense. The second part.
Okay, so I'll just speak to the immune escape. And I think at the moment with these rapid increases and with what we know about the mutations in Omicron and some preliminary data that we have, there's definitely evidence that it is more transmissible and that there is some immune escape. But I think it's not necessarily that is related to severity. And so we can't really make any cause in terms of severity just based on whether it's more transmissible and has immune escape, because you could have a very transmissible variant that could cause mild disease or vice versa. So I think in terms of the severity, it really is early days. I think we need to have more information over the next 2 to 3 weeks in terms of this, and I think in the interim, I think we just need to prepare. I think we're expecting disease to be, well, we know that disease will be less severe in the vaccinated, and so it's more likely that we would be having the more severe disease outcomes in the unvaccinated. Thank you, Foster and Honourable Minister.
Thanks, Dr. Michelle Groom. I'm not sure if all the questions are answered, Dr.
I think Dr. Maluleke, on the Gauteng positivity, I think it's not a complicated one.
Thank you, Honourable Minister. Earlier on this week, our test positivity was 19%. According to latest report just presented now by the NICD, it has increased to 34%.
Yeah, you can proceed, Foster. Maybe take a next round.
Okay, thanks, Doc, and thanks to panelists. Let me take the second round. The first question of the second round is as follows. A friend of mine told me that she took her 14-year-old child to be vaccinated, and unfortunately was turned away and being told that they don't have correct dose for teenagers in stock. Can the teenagers be vaccinated only at certain vaccination sites? I think Dr. Chris and other colleagues will be able to respond to this. The second question is from Miriam Issa. It is as follows. Do you know why there are so many young people testing positive at the moment? Is it because fewer have been vaccinated, even though it was partly responded to, but colleagues can still feel free to elaborate on it. The third question is from Gabriele from Wall Street Journal. It is as follows. I'm a bit confused by the hospital data. The numbers have changed, but the graphics say both data were up as of from November 27. How does that add up? Is it more data still coming? Another question, admissions are rising faster now than in previous waves. Are they up as percentages of positive cases, given that the cases are rising so much faster? As infections among children were noticed in the third wave and now again, is there consideration being given to opening vaccines to younger children and consideration given to the current cohort of children, both doses of vaccines? This one is simply saying, as we know that currently in the country, we only give the 12 to 17-year-old one dose of Pfizer vaccine. So it's asking if is there any consideration to give the second dose of this vaccine. Question.
Sorry, can you just repeat the one before this one? The one
which
before
one?
The children. Before
the children,
yeah.
I'm going to summarize it. This person is asking, as infections among children now are noticed in the third wave now, is there any consideration given to open vaccine to younger children?
No, I got that one.
As we know that currently we are only giving the young children between the 12 to 17-year-old age group only one dose of Pfizer vaccine. So is there any consideration to give them the second dose of Pfizer vaccine? I'm not sure if I understand, Minister.
The one before this one.
Then there's questions directed, the second question directed. Yes, Minister.
I was asking the one before. The
one before is about admissions, saying admissions are rising faster now than in the previous wave. Are they also up as percentages of positive cases, given that the cases are rising much faster? So meaning that the cases are rising, but the positivity rate, is it also going up as the number of cases is going up?
Okay.
Is that clear?
Yeah.
Okay.
You can proceed. Yeah.
Okay. The question is directed to Dr. Wasil. What is the reason why so many children under the age of 5 has been hospitalized? Does it mean this variant Omicron affect more children as compared to the adults? This one also has partly responded to, but can still feel free to elaborate on it. I'm going to take I'm left with about 4 questions. I'm going to take all the questions so that we'll be able to elaborate on them. Another question is, has anyone with Omicron variant died, what are the numbers in the ICU as far as the Omicron? Hospitalizations by age imply that the vaccine status is having an impact on reducing the hospital admissions. Is this your takeaway from the data, or is it this that this virus is simply more serious in younger patients than the Delta variant? So this one is still talking about the infection rate among the children by this variant. The last question, last two questions. Why do you think the admission in children below the age of 5 have risen so much more versus the prior waves? Last question. There are currently 106 patients in the ICU in Gauteng. We have recorded 26 deaths in Gauteng in the last 2 weeks, of which 23 were in Tshwane. We don't know if these people have died of Omicron variant or they just died of any other variant. Lastly, the last question is as follows. Would you be able to give us the number of cases of Omicron variant detected in South Africa since last week? So this was the last question of the second batch, Honorable Minister and our panelists. We'll be able to distribute accordingly. Over to you, Minister and members of the panel.
Can I just ask, I think many of this between our NICD colleagues, some Gauteng, maybe Dr. Crisp and Buthelezi can help, but in terms of maybe let's start with the one which Dr. Crisp can handle, of 14-year-old turned away, whether there's specific sites he can deal with that. And then the mostly young people, hospital data. Can I ask? I think most of them, and then also Dr. Crisp could deal with whether there's consideration to open for younger children because of the new rate of infections. But I think the vast majority, if our two colleagues from NICD could be ready to handle the lion's share. But let's start with Dr. Crisp.
Morning, Minister. Morning, colleagues, members of the media. Thanks very much. So the answer on the first one is that the vaccine that is administered to adolescents, the children from the age of 12 to 17, is exactly the same vaccine. It's a Pfizer vaccine. And so if it is available at a vaccination site, then it is available at that site. There may be a few sites that only have Johnson & Johnson vaccine available. And if that is the case, they can't use the Johnson & Johnson vaccine for vaccinating children because it's not approved for the use in under the age of 18. But that's the only explanation I can think of. And if the people who are asking the question would like to contact the department, we can give them a more specific and definitive answer. As far as the question of vaccinating under the age of 12 is concerned, there's no vaccine registered in South Africa yet for use under the age of 12. We await vaccination applications from the manufacturers for use of vaccines at different ages and for different boosters and intervals. And when that is authorized, then we are able to open it for vaccinating under the age of 12. But at the moment, we know that there are some other countries that have started doing that, but we haven't had an application to my knowledge. We did get an indication that Pfizer was going to make an application in the early part of next year. So it's not likely that we will have that in the very near future. Thank you.
Yeah, I think we should invite our NICD colleagues.
Thanks, Honourable Minister. I think I'll just speak to the number of Omicron cases. So I think we don't sequence each and every case that is detected. And so we can't, I mean, it's impossible. Yeah. So from our sequencing, we can see that Omicron is rapidly overtaking the Delta, and that this is happening in most provinces. But I think, so we will be able to give a proportion that we suspect, but not every test sample is going to be sequenced. So I think we'd have to use that as a proxy. We are trying to update some analyses in terms of this particular variant that can be detected by some of the PCR tests that are being conducted. And so that gives us a way to be able to look at things like severity and the distribution. But we will be able to provide data in the coming days and weeks. And I think I'll hand over to Wasila for the hospitalization questions.
Thank you. There was a question about the hospital data being different when it's presented like at different time points. And I just wanted to explain that we rely on hospitals submitting data on our surveillance platform. And we analyze data for epi weeks, and the epidemiologic week ends on a Saturday evening. And so often, we have data lags, especially over the weekends when the hospital data capturers may not be on site to submit data. So when I present the data for the epi week on a Monday, it might underestimate the true number of admissions, because as they get to work on a Monday, Tuesday, they start backfilling admissions that may have happened last week. And so later in the week and by the next week, we have a much better picture of the numbers of admissions in the previous week. So I think it's just a matter of sometimes lags in the data being submitted. The question around, with the increase that we're seeing, and has it changed the proportion of patient cases that are admitted? We always see that between waves, a higher proportion of cases are admitted because there's few cases, and sometimes there needs to be hospital admissions. But as the wave and the surge progresses, and particularly at the peaks, there's a very low proportion of cases admitted. And that's because there's high numbers of cases, there's not enough beds, and so the proportion of cases admitted are lower at the peaks. So right now, the proportion, even though cases are rising very sharply, hospital admissions are also rising, the proportion of the proportion of cases that are admitted are still quite low. And then the important question I think many people have asked around why there are so many children being admitted in hospital. There's a few reasons, like I said before, there's a lot more testing in the hospitals of all cases, all people admitted, even for other reasons, for other medical conditions or for elective surgeries. And so they're picking up incidentally positive patients who may not really be sick or have other symptoms of COVID. Another thing, as I said, is, there's a probability that clinicians are admitting patients as a precaution while there are beds available, and so more young children are being admitted, whereas later in the wave they wouldn't meet the criteria for admission. But certainly there is a possibility that there is just a difference with this variant and in this wave, with it being more transmissible, possibly that kids can be more susceptible. But we do know that there is an immunity gap, with adults being with higher coverage of vaccination in adults. Children are then susceptible, especially children who are not vaccinated. And so it's likely that as the vaccination coverage increases in adults, the children who are not vaccinated are the ones that are susceptible, and they may be the ones that get sick and need to be admitted. Just anecdotally, the pediatricians in the Tshwane Hospital shared with us that of all the children that were admitted, all those 12 to 18 who were admitted were not vaccinated, even though they were eligible. And the younger children, less than 12, who are not eligible for vaccination, none of the parents, except for 3, were vaccinated. And so, it's interesting that all these young children being admitted, most of them, their parents have not been vaccinated either. So I think certainly the value of vaccination in the adults protecting the children in the homes is something to be borne in mind. Thanks.
Dr. Jassat, I don't know whether you might have touched on it. There's a question as to whether we have a record of any patient who died from Omicron. You might have alluded, but I think there was a specific question. You might be able to say something.
Thanks for reminding me, Honourable Minister. Sorry, I answered it in the chat and forgot to answer it here live. So thus far, just looking at our data in Gauteng over the last 2 weeks, we've had 33 deaths in Gauteng, of which 23 have been in Tshwane. Unfortunately, as Dr. Groom said, we don't have, genotype on them, so we don't know of those patients who had the Omicron variant and who didn't. And then also we, at the moment, currently there are 106 patients in ICU in Gauteng.
Can I just check with Dr. Buthelezi if he might have picked up something which he might want to comment on before we get back to Mr. Mohale Foster?
Thank you very much, Honorable Minister and colleagues. I think the colleagues have covered everything, Minister. Thank you for giving me an opportunity. Thank you.
Thank you very much, Foster. I think we can get back to you. I suspect we don't have more time. I'm sure that, I think you were saying those were the last. I think the team has dealt with everything. So maybe back to you just to check if that I'm correct. But I think the time also is not on our side.
Yeah, Honorable Minister, you're quite correct. That was the last round of questions. Yeah, I've been trying to get hold of the Deputy Minister. As you can see, he's not on the list. He's experiencing connectivity challenges. On that note, I'm going to request the DG to do the closing remarks. But before I do that, I'm going to hand over to your Minister to give us that last parting shot. Minister.
Well, I think this message has been reiterated, myself and the team, that we can manage this fourth wave. We can manage Omicron. The basic tools we all know. We can still have a reasonably, successful festive season. We can still manage to manage this in a manner where government doesn't have to invoke serious restrictions over the next few days. If we all just do our basic duties of the safety measures, but also if more and more of us who are eligible, everybody from 12 years upward, approach the nearest vaccination sites to receive our jab. And also, again, lastly, just to call on those who have had only one dose of Pfizer and who are already qualified and due for second dose, please go ahead and receive your second dose. Thank you very much, and over to Dr. Buthelezi to do the honor of closing.
Thank you very much, Honorable Minister, members of the panel, our esteemed colleagues from NICD, Dr. Michelle Groom and Dr. Lucille Bloomberg, our colleague from Gauteng, Dr. Nzwanisi, our colleagues from the National Department of Health, Dr. Crisp and Mr. Morewane, esteemed members of the media and our partners who are always supportive of us. Thank you very much for being with us this morning. Again, the Minister has covered very well and summarized everything appropriately. I see that there's been a question that is always on my screen. The issue of mandatory vaccination, the President has put in a task team that's working on that and will advise at the right time. So that's all we can say as the National Department of Health for now. But more importantly, we really want to thank our members of the media for always communicating, and we are really indebted to you. Let's communicate positive news. Let's communicate to the people in terms of the public health measures, which are still the #1 prevention and also the vaccination, so that we ensure that we are able to survive this pandemic. We really want to thank our health workers who are at the forefront, and we are saying without you, we would have been somewhere else, but you've been dedicated to do this work, and we'll do our utmost best within the difficulties that we have in the department and in government in general to ensure that you are supported, you deal with the matters. And to our public, please just go out and vaccinate. Let's have a positive message. let's protect each other. Thank you very much, and I'll hand it back to you, Foster.
Thanks very much, Shenge, Dr. Buthelezi, for closing remarks. Thanks to Honorable Minister, members of the panel, members of the media, fellow South Africans, once more for being with us and listening to us. Indeed, working together, we can defeat this pandemic. On that note, I'm going to declare this media briefing adjourned until further notice, and want to comment and commit that as the department will always be there for the media, even though we may not be able to answer all the questions at a time because of the time limits. But we assure you that we will always be there to take your media queries, media interviews, even beyond this media briefing. On that note, I'm going to say until we meet again, thank you.
Recording stopped.
Yeah.